Great, thank you very much. Interesting choice of topic when people are still eating their breakfast. The reform of food safety regulation as is happening in North America at the current time always raises many issues. You know, why is it necessary? Is it going to improve the safety of food? What's going to be the impact on business and so on? I would argue if you really want to understand the answer to some of these questions, and I'm only going to be able to gloss over a lot of them given time, you have to look in the broader context. You can't just focus on regulation. You can't just focus on Canada. You have to look at it more broadly, and that's the perspective that I'm going to use. Okay. What I'm going to do is first talk a bit about the context, then talk about trends in food safety governance, which is a wider concept than regulation. I'm going to pose the question, how well is food safety governance performing in Canada? And then Paul and I can maybe have a discussion about this. I'm going to talk about how food safety governance is evolving in Canada, and then talk a bit about some of the implications and issues moving forward. Okay. First of all, the context. Foodborne illness in Canada is incredibly persistent. We can argue about whether it's high or low, it could be lower or whatever, but there's still a lot of it around. The latest estimates are around 4 million cases a year. We only actually know around 35% of them where they're from, what in the case of bacterial or microbiological, about 35% we know the organism involved. We know of that 35%, the main pathogens, and what may surprise a lot of people is actually the most important one is actually norovirus, a lot of cases of which don't actually come from food. But then there are some of the sort of villains that everyone has heard of, like salmonella. The other thing that's important to recognize is that most cases occur actually sporadically. They don't actually occur as these high-profile outbreaks that hit the headlines on the news. So there's a lot of cases around. We don't actually know the exact number, and this is the best estimate or guesstimate that we have at the current time. At the same time as the persistence, we have new and emerging foodborne hazards. Some things go up the agenda, things like mycotoxins, for example. We have the emergence or the growing importance of viruses in food, things like norovirus, etc. So we have to deal with the old stuff, and we're also dealing with the new stuff, okay, which of course creates a lot of challenges. And of course, while all of this is going on, and even though most cases occur sporadically, every so often we get these big outbreaks. And they occur amongst entities that a lot of the time people have a lot of trust. Maple Leaf, you know, a name, a brand that everyone knows, and yet 22 people dead. You have XL Foods, the second largest beef processor in the country. So this is things that are happening in big companies. And then it occurs in foods that are supposed to be good for us, like cantaloupe and spinach. So all of these outbreaks raise a lot of political issues, of course, but they also begin to shake the trust of consumers. Actually, not as much as I would expect, but they do begin to question in the minds of people whether the systems we have are actually working very well. Consumers themselves are arguably exposing themselves to more risk. A lot of our food safety system is based on this idea that we cook something really well and all these bugs get killed. Increasingly, we're consuming foods that we don't cook. They're ready to eat. They're only partially processed. Things like salad mixes and this sort of thing. And that then means that consumers necessarily can expose themselves to risk, or at least they don't have at their own disposal mechanisms to control that risk, like how long they cook something. And all of this affects consumers' expectations, their perceptions of risk. Of course, different people have different demands in terms of the risk that they're willing to expose themselves to, in terms of how they expect the food system to perform. And this is also evolving, and it varies across foods, it varies across hazards, and so on. So there's all that going on. And at the same time, there is increasing trade. And in a lot of countries, the food safety system has very much focused on the domestic, whereas increasingly, food systems are global. And we know this, of course. So these are some estimates of the proportion of the food consumed in Canada that's imported. And these numbers are really high for some of these food items. You know, these are not far off 100%. Okay? So imports really matter for some foods. So what happens somewhere else in the world is really important. And we import foods from all sorts of places, including places where we might have questions about their food safety system. Canada last year imported fish and fishery products from 121 countries. The most important was the US, but also there is China, Thailand, Vietnam, India, etc., which we may have some questions about. They may be legitimate, they may be perceptual, but there are certainly questions. As well as trade becoming more important, okay, and we tend to think of trade in terms of commodities, it's also important to recognize that global food safety, global food value chains are becoming very complicated. This is some recent work by the OECD, and this is Nutella. Okay, and you could choose commodities for which the value chains are far more complicated, except this one looks nicer. And what you see with Nutella is that the value chain for Nutella involves importing products from, these are the major ingredients of Nutella, from a variety of countries, from Malaysia, China, Nigeria, Turkey, from Brazil. And this doesn't even include the minor ingredients like lecithin and whey, which the OECD estimates may come from as many as 30 countries. This, of course, means that you have new risk pathways. It means what happens somewhere else, there's a food crisis, there's an outbreak, affects us here. So the complexity of these systems means that we have to take account of what is happening elsewhere in the world. And many of the products we consume, many of which may include very minor ingredients, can actually pose quite significant food safety hazards. Okay, on to governance. For many, many years, and still for many people, when people talk about food safety, they talk about regulation. Now, I'm going to use a far broader concept of governance. Regulation is about what governments do. Governance is about the competing roles, responsibilities of consumers, government, and business in managing food safety. And it is this system that is evolving. Government is there, which is the regulatory sphere, but there's also other things going on. And understanding food safety in the context of the roles and responsibilities of these different actors and expectations about what they do, what they should do, is critically important and is actually at the heart of a lot of the debates about food safety systems. Now, what we see in terms of governance is, first of all, a lot of regulatory reform. And the regulatory reform going on in food safety is actually not that much different to in other areas where we're managing risk through regulation. So we're bringing on board system and management-based standards, things like HACCP in the case of food safety, codes of good manufacturing practice, this sort of thing. Increasingly laying down performance standards, based on outcomes, for example. So not saying, these are all the things you have to do, but saying, you have to produce safe food, we're going to give you guidance on how you should do it, we've got certain expectations, but we're then going to give you some latitude, we're going to give you some flexibility as to how you do it. And finally, the standards we lay down, the regulatory standards, and the way in which we assess conformity, we inspect, is increasingly risk-based. So we don't apply the same system to all the commodities, to all the different types of business, but that we apply some risk-based parameters to try and focus on where there are the biggest risks. And those sorts of changes, and you'll see them when we come to what's going on in Canada and the US in a little while, are not atypical of regulation in the broader risk area. The second thing that's happening, and I think this is very important, is that there's a focus on the structure and the way in which value chains operate. There's a movement away from the idea that food safety control is about regulation to about food safety control is about the way in which value chains operate, and what regulation does is influence that. What we know, I was actually going to use my pointer, I'll still try and use my pointer, is most cases of foodborne illness occur down here. They occur when you go to a restaurant or they occur in your home. Okay? Now that does, and some of this is because we do stupid things, and some of it's because restaurants do stupid things, but it's also because things haven't happened up here. Okay, so that hazards come down the value chain, so that if we don't do things down here, we then expose ourselves to particular foodborne pathogens, for example. So we have to see it as a system. We have to see that regulation and broader standardization systems essentially set the frame within which this operates and which it manages food safety. And then we have to see the broader frame of things like the WTO, of things like international standards that lay norms, that lay down rules for what states can and cannot do in terms of how they choose to manage food safety. So the focus on this broader value chain system, I think, is a very important way, and I think actually a very positive way in which perspectives are changing. Third thing we're seeing is the blurring of regulatory boundaries, and this is the thing that really gets legal scholars very excited, because legal scholars have at the moment a near obsession with understanding regulation beyond the strict role of the state and the traditional ways in which we think about regulation, which is what they would call public regulation. It's the state regulating private entities. And they would argue that what we're seeing across so many spheres today is, first of all, firms regulating themselves, norms establishing in communities of practice, norms establishes in business, so that there are practices that become norms even though no one may tell you that you actually have to do them. And things like the implementation of HACCP are examples of that. And then finally, private regulation. Private regulation is firms regulating other firms. It's not firms regulating themselves. It's other firms, like Loblaws, telling its suppliers what they have to do. Okay? And that we have overlapping regulatory systems. These things are not distinct. They respond to one another. They fill gaps. One motivates the other. And so we have a very complex system of governance of food safety, as we see also in other areas. And that's how we have to see the world of governance of food safety. Part of that is the role of private standards. And you can't go to anything about food safety without talking about private standards. Private standards are standards and the related systems of conformity assessment, normally some form of certification, particularly third-party certification, that are laid down by private entities. So, non-state actors. Now, sometimes that's individual businesses, like McDonald's has its own food safety standards and systems that it applies to its suppliers. Sometimes they're collective, so private entities get together, retailers or manufacturers and whatever, and what they do is they define standards that are then applied across a sector. One example is the BRC global standard, which was developed in the UK, but actually has global reach, even though it was developed just in one country. And then we have collective international standards. Again, private entities, but entities that cross boundaries. Global Gap is the one that everyone has heard about, but where you've got, in that case, both producers and purchasers, mainly retailers of fresh produce, and then increasingly other things as well, laying down standards and systems of conformity assessment that are applied internationally. And on top of that, you have systems of benchmarking. The Global Food Safety Initiative is comparable to, in many ways, Codex Alimentarius. It lays down norms internationally that all of these systems increasingly comply with, so that they become interchangeable. And so we have this whole system of private standardization that is lining up alongside traditional regulation. And then on top of that, we have the whole evolving role of international government arrangements, questions about the role of the WTO, questions about the role of things like Codex Alimentarius and other international standards organizations. And that's occurring alongside all of these things that I've talked about above. So the situation is incredibly complex. Okay, now on to Canada. So how well is food safety governments performing in Canada? Well, it depends who you talk to. No surprise if you talk to CFIA, sorry, Paul. This is a quote that is in one of the recent documents associated with the Safe Food for Canadian Act, which says Canada has one of the best food safety systems in the world, but continuous improvements needed, etc. That sounds great. These are a couple of media reports, one in the Globe and Mail, one in the Huffington Post, relating to the latest Auditor General report on recalls, and one on the results coming out of the US audit of inspection of slaughtering facilities for meat. So, of course, it depends who you talk to. But actually, it's incredibly difficult to judge. Number one, we have really imperfect data. We don't really know how many cases of foodborne illness there are, and we certainly don't know the pathogens that are involved in 65% plus of the cases. Secondly, there are no absolutes. We can always do better. There's no absolute to say this is a good system, this is a bad system. It's about choices and it's about judgments. And finally, there are critical trade-offs here. We could probably improve food safety, but it might mean we impose very heavy burdens on business, particularly small business. And so we're making judgments all the time. Now, these are some of the metrics that however, we might use. So we might look at the incidence and economic burden of foodborne disease, however imperfect the data. We might look at what consumers think. Are they happy? Do they trust? Do they go out worrying all the time that food is going to kill them, or do they have confidence? We might look at how well Canadian business performs in exporting. And we might look at the impacts on the agri-food sector. And I'm just going to give you just a bit of data just to illustrate some of these. Well, if we look at Campylobacteriosis, which was on that list of 4, if you remember, that I showed earlier, well, these are the estimates of the incidence of Campylobacteriosis. And what you'll see is that actually Canada is somewhere in the middle. The US does better, Australia does quite a lot worse. It's got better in Canada. Now, is this due to difference in surveillance systems? Maybe. Is it because the US system is better than the Canadian system? Maybe. It's very difficult to judge. If we look at S-Tech, V-Tech, what most people call E. coli, what you'll see is that Canada actually doesn't perform as well as Australia and the US. It's come down quite a lot. Is this due to environmental conditions in Australia, the fact that they have far lower rates? Or is it the food safety system? Again, it's a judgment call. It's very difficult to say. So that's the human health implications. What about consumers? Consumers have remarkable trust in food safety in Canada. So these are some figures from the panel that we've been operating at Guelph. You can see similar numbers from Decima and other sort of survey work. What we see is a very significant proportion of Canadians trust the safety of the food they eat. There was a bit of a blip here after, from 2008 to 2010, after the maple leaf situation, but things have improved. But we're basically talking about 60-70% of people actually have remarkable trust. And comparable numbers think Canada has the best food safety controls in the world. Okay? However, if you try and get at what perceptions of risk those views are based on, what you find is that people actually have a far more optimistic view of the risks that Canadians face than they actually do. The best estimate of the proportion of people in this room, or at least the proportion of Canadians, who will suffer, on average, a case of foodborne illness in the next year is about 12%. Okay? What you'll see here is that most people are actually below 5%, which is less than half the actual risk. So people have actually a very optimistic view of the risk that they actually face. So maybe that explains the amount of trust that they actually have. I would argue, why should they actually know the risk? But we at least need to understand what underlines the perceptions that they have. What about trade performance? Well, difficult to judge. We're actually doing some work at the moment for OMAF in Ontario, where we're trying to understand through surveying continuously firms on the food safety problems they face in complying with exports to the US. But probably the best continuous data we have is on border rejections. It's only the tip of the iceberg. And these are the number of rejections that we see. It's typically between 300, 500, 550 a year. It goes up and down. Canada, on the basis of border rejections, is actually the best performing importer of agri-food products into the US. And actually, the number of rejections on average is about 0.1 rejection for every $1 million of imports into the US. So it's actually incredibly small. Would we want it lower? Probably. Is this a major issue? Probably not. And finally, there's the impact on business. Now, whenever you talk to business, of course they're going to say the burden is high, okay, because they're using that as a way for arguing for less burden. If we want to understand the burden, however, we have to put it in a broader context. All firms across the world will incur burdens complying with food safety regulation. What matters in terms of competitiveness is how the burden we impose on Canadian firms, or the burden that one province imposes versus another province, and so on, differs. The big issue, the one that is a big concern, is the fact that, and these are numbers from the Conference Board of Canada, is the fact that the burden is far greater on small firms than on big firms. And so there are a lot of concerns about the impact that regulatory burdens can have on the viability of small firms in the food processing sector, for example. And this is certainly, I know in Ontario, a very big political issue. So that's about the performance. Now, presumably the performance isn't good enough because we're changing it, okay? So presumably we have some concerns, because otherwise we would just go on doing what we were doing already. Now, if you want to, I'm going to talk about the changes that are happening, but the first thing to recognize, because not everyone sort of knows the intricacies of food safety regulation in Canada, is that the system is multi-tiered. So, this is Guelph, okay? I do see the world beyond Guelph, but I thought I'd use it as an illustration, okay? So, in Guelph, okay, the food safety system looks something like this, okay? You have the federal government, okay? This is Paul, okay? Now, Paul really matters in terms of the majority of food sold in Canada and the majority of the value added of the agri-food sector, okay? Because the CFIA and all the other parts of the federal government regulate all interprovincial trade, and they regulate imports, okay, and also exports. But for some commodities, it's a really quite heavy-handed approach, like meat. For others, it's non-existent, but very light touch, like the bakery sector, because it's a non-regulated sector, okay? But there's the federal government. The vast majority of businesses, for them what really matters is actually provincial or territorial governments or your local or regional public health authority. And it's these, by the way, that regulate all the food service sectors where, of course, a lot of the cases of foodborne illness actually happen. So what we have is a system that's multi-tiered according to whether we're talking about imports, interprovincial trade, or just things that are produced and sold within a province. It differs by commodity, like meat, for example, versus fruits and vegetables versus the bakery sector, and so on. Now, what we're going to be talking about is actually up here. Reform at the federal level. We do see changes occurring down here, but there are differences between province. But it's important to recognize we have a multi-tiered system. The other thing to recognize is that the reform, the system here is actually quite tightly interconnected with what goes on in the US. Not just because we import a lot of stuff from the US, but there's a lot of cooperation, there's a lot of sharing of information, there's a lot of use of risk assessments here that have been done in the US, and so on. And as you'll see with the reforms, there are a lot of aspects by which they actually mirror one another. Okay? So, let's look at the reforms. Okay, this is a long list. Okay, first thing we have to accept, Canada wins on the name of the legislation. Okay? Safe Food for Canadians Act. Sounds beautiful, doesn't it? Food Safety Modernization Act. Yeah, the marketeers weren't involved in that one. Okay? So anyway, we see a lot of things going on that are very, very similar. Okay? So for example, by the way, one thing I should just say is that the Food Safety Modernization Act in the US is about what the Food and Drugs Administration do. The Food and Drugs Administration, by and large, pretty much almost entirely, are not responsible for meat and poultry, whereas this covers all foods, okay? So that's one sort of important thing to recognize. But putting that aside, we see some very similar things happening. First of all, the implementation of HACCP-based, what are called preventative control programs, essentially pushing the onus and the responsibility onto food businesses to take preventative measures to ensure the food that they sell is safe, and also the food that they import. Okay? So we see there are differences between them, but the shift, fundamental shift in responsibility to require firms, businesses to be proactive, to be preventative, to have systems in place is something that we see happening in both legislative regimes. I meant importer responsibility for the safety of the products they import. So putting the onus on the importer to be able to demonstrate that the food they import is safe and complies with food safety management practices, controls that are equivalent to what happens here. Same thing is happening in the US. Traceability. In both the US and in Canada, there are certainly moves to bring in traceability. Far more definite in Canada than in the US. The US is still sort of making decisions and has very much a focus on high-risk commodities when they've determined what they are. A more comprehensive system is suggested in Canada. I mean, both of these things are evolving. Okay, both of these things have been out for discussion. The enabling regulations are still to actually be put in place, etc. But this is the sort of sense that we get. In Canada, there's a lot of tidying up. When the CFIA was brought into existence, it basically brought in all sorts of commodities that previously had been had laid somewhere else in government. There were lots of pieces of legislation that had different approaches. So there's a lot of consolidation, a lot of movement towards outcome-based requirements, etc. That is very much consistent with this idea of sort of HACCP-based preventative control plans. Okay. Two, I think, distinct things are, first of all, in the US. The US has made it far more explicit that it sees a significant role for third-party, that means other governments or private entities, certification. It actually sees a role, and it's made it very explicit, for accrediting third-party certification as a way of verifying the safety of imports, and has made a large play of that particular element. There are hints of it here, and maybe Paul can tell us more, okay, but it's far less explicit. The one big thing, there are a lot of other things on this list, but the one big thing I think that in Canada are the plans in terms of licensing. CFIA's plans as they currently lay are that every entity involved in international trade and interprovincial trade will be licensed. It has even posited that exporters might be licensed as well. Okay? And the licensing could have quite significant implications, because what it will mean if you're licensed is that you will come under all of the requirements of the Safe Food for Canadians Act, including some entities at the moment have a relatively light regulatory regime, like the bakery sector, for example. Okay, and on top of what's happening in terms of regulation, we see the evolution of private standards. And then what we see in Canada is that, at least domestically, we see the rapid evolution of on-farm food safety programs. Okay, so what we're seeing is we have Canada GAP, and we have a whole host of other commodity-based systems of private standards that are actually verified by the CFIA, but they have been very much developed within Canada. They're benchmarked internationally, absolutely, but very much developed in Canada. Look at the processing sector. It is very largely the use of international collective standards or even national collective standards. So these are standards developed somewhere else in the world and being used here. Okay? And then we have individual business standards. It's not surprising that the big food service companies, like McDonald's, companies like Loblaws and Costco and Walmart have their own private standards. Some of them require use of these other standards, certainly things linked to GFSI. Some of them are entirely proprietary to them. But what we're seeing alongside what's happening with regulation is this evolution of this private standards regime. And that the two, I think we will see, and we're already beginning to see, are actually allied to one another. Okay, finally, implications and issues moving forward. What does all this mean? I think there are big questions about CFIA's reach and resources, because there's no doubt that the reach of the CFIA will be enhanced by these changes. I think it's assumed that new approaches to regulation, new approaches to inspection will mean that the same levels of resource will go further, but of course that's something that we'll have to see. But certainly I think there are issues to do with the CFIA that matter. Undoubtedly, we're seeing the increasing role of private standards. In some agricultural commodities, the majority, or certainly of producers, are now certified to private standards, and certainly the ones that account for the lion's share of production are certified to private standards. So they are within a parallel regime. I think all of this raises very interesting questions about the interrelationships between what the government is doing, how the government is regulating, and the private standards regime. And a lot of regulators around the world are struggling with this issue. They see a world where we're regulating and we're going to entities, processors, farms or whatever, who are already audited and already compliant with standards that may even exceed regulatory requirements. And how do we make use of that system? We're beginning to see sort of these universes, these systems overlap. So, for example, in Canada, you see the on-farm and some post-farm food safety systems being recognized by CFIA. So that what the government is doing is giving legitimacy to this private system. Okay? And that is actually, I think, a very interesting Canadian phenomenon. You don't see that in Europe, for example. We're seeing some public entities develop their own voluntary standards. I think the best example is Ontario's development of the HACCP Advantage and HACCP Advantage Plus standards that are actually then managed, and the systems of certification occur through the Canadian Standards Board. They were developed by the provincial government, but since then they have really no further role except to promote them. So that's the second example. I think we're also seeing beginnings, if not formally, informally, the use of private standards compliance by entities like the CFIA. So, for example, there seems to be some indication that Feed Assure, which is a system of private certification for the feed industry, accounts for something like 70% of feed production in Canada, that it's been recognized as equivalent to regulatory requirements by the CFIA, and the CFIA has indicated that those entities that are certified are or may be inspected less. So that this is based around this idea of risk-based inspection. So we're beginning to see a system where these two are coming together. And in the recent discussion paper put out by CFIA on the Improved Food Safety Inspection Program, this was, I'll let you read it, this is a direct quote from that document, suggesting that, again, CFIA is looking at this, struggling still a lot of thinking to do as to how you use this information, how you use this parallel system, but at least recognizing that we need to move down that path. I think there are remaining issues and will continue to be issues about how we effectively regulate food safety in a global context. This whole issue of what we do about imports. Undoubtedly moving away from import inspection, etc., but how far you go down that route, how systems of accreditation work and whatever. Of course, there are big concerns about impact on the agri-food sector and whether this imposes inordinate burdens and so on, the impact on small firms and so on, and that is going to continue. What is the impact of the Safe Food for Canadian Act on the industry? Difficult to say, but will certainly vary between whether you currently come under the remit of the CFIA, the meat sector, for example, or you're the bakery sector. Okay, so there could be very significant differences in terms of impact. What about consumers? This is a tough one. In general, it's not a good sell to say that you're giving the responsibility to business to ensure that the food they sell is safe, because it's the role of government to regulate them, remember? People don't really understand what regulation is, but that's what they understand that what regulation does, okay? And so they may not want their food to cost more, and they don't want businesses to go out of business, but they want government to be there to be making sure that they do the right thing. And finally, I think and you're beginning to see here, but you're certainly seeing elsewhere, fundamental questions about the role of government. If we have a world where much of the private sector is essentially regulating itself through private certification systems, where does that leave government? Is the government's role to mop up the bits that are not regulating themselves? Lots of small businesses, sectors where those things have not been implemented? Is it about essentially recognizing and enforcing private systems of regulation, making sure they're working well, and then riding on the back of them? I think these are going to be ongoing questions that we are going to see, and I think we're only at the start of that debate. Okay, finally, conclusions. Undoubtedly, globally, food safety governance is evolving. It's not just a Canadian issue, it's an international issue. We have to see it in terms of governance, not in terms of regulation, okay? So the changes that are happening here, part are being driven by what is happening in the rest of the world. Some of them are driven by events at home, but very much you're seeing an evolving system with very tight interrelationships. I think necessarily we're going to see, and we need, further evolution of this public-private regulatory interface. That's going to be absolutely critical. I think we may begin to see a start of a fundamental shift in the role of government. I think that there are debates are starting, and I think that that's certainly one thing we will see. And to be slightly provocative, I wonder whether, I mean, it's very interesting if you look at regulation of food safety. Historically, Canada was actually very much in the lead. Canada was the very first country in the world to require, under a regulatory system, the implementation of HACCP. The Food Safety Enhancement Program implemented by CFIA was very much an international first. If you look very much at what's happening today, it sees that very much that what is happening here is being driven by what is happening elsewhere. Now, that may be appropriate in many contexts, but maybe not in every context. Okay, I'm going to leave it there.